Hello?
Hey, what's up?
I lost you. Like it froze.
Yeah, don't worry. All good.
Okay. All right. But definitely get in touch with her, and then we'll call you and let you know when we can do this. Okay.
Okay, cool.
All right.
All right.
Thank you.
Thanks again.
I love you.
Love you too.
No problem. All right, I'll see you soon.
Okay. Bye bye.
All right. Bye.
Hi, this is Pam Nichols with the Move Something Conference 2017, and for the month of December we are going to talk about the topic of Graves' disease. And what better person to talk about this topic but my mother, Dorothy Nichols, who is an RN, who does have Graves' disease. She will talk a little bit about what she has endured and some of the symptoms she had to deal with. And as of December 1st, she is officially going to retire. She has done over 40 plus years as a registered nurse, and she has worked in oncology for a long time. So here's my mom, Dorothy Nichols. Hi, Ma. How you doing?
Hi.
So, Ma, when you first got diagnosed with Graves' disease, what were some of the symptoms that you had?
Well, it started with watery eyes. I had pain in my eyes, and I had gone to my eye doctor, and my eyes began to budge a little bit. And he said, I think you have Graves' disease. And I went to my doctor, and then she sent me to a specialist who did some blood work, did a TSH, and a TSH was elevated. TSH stands for thyroid stimulating hormone. It is secreted in the pituitary gland in the brain. And usually if your TSH is elevated, you find you have thyroid problems. And usually with Graves' disease, you also, it's commonly called hyperthyroidism, where you have hard palpitation, heat intolerance, diarrhea, weight loss, irritability, nervousness. And my doctor told me I had three choices. I could take the medication, I could have the iodine capsule, or either I could have surgery. So I chose the medication. I took medication for 2 years, and my Graves' disease got better. And then my eye doctor did the surgery. He did a decompression of both of my eyes with laser surgery. And now I'm okay. I don't take anything. My doctor checks me every 3 months, every 3 or 4 months when I go to see her, check my TSH, make sure it's within normal range.
Okay, so when were you first?
And I've been free since about 15 years.
15 years? Wow. So when were you first diagnosed? At what age? How old were you when you were first diagnosed?
I don't know exactly, but I had to be like in my 50s.
Oh, okay. Okay. So when you have the Graves' disease and you're saying the surgery, is there surgery to have your thyroid removed? Is that one of the?
That's when you have a goiter, but your thyroid has to be removed.
So what exactly is that?
But right now I don't have a goiter. That's an extra growth in your. You have a butterfly-shaped gland in your throat between your larynx and your voice box.
Mm-hmm.
And if that growth is real big, then you have to have surgery. But mine's not that case.
Oh, okay. Okay. So, for anyone who is diagnosed with Graves' disease, what would you recommend as far as maintaining and making sure you stay healthy? Like once you find out.
Once you're diagnosed, you really need to go to your doctor and talk to your doctor and make a decision there. You have 3 decisions. Either you take the medication, you take the iodine capsule, take it away all, completely, or you just have the surgery. So surgery was my last resort, or either the capsule. So I decided to do the medication.
So
but it's individualized. It's up to the person what they want done.
So actually, if you have Graves' disease, once you take the medication and do the right things, you actually won't have the issues anymore. You can be.
I can't say that. I said I took the medication for 2 years.
Mm-hmm.
It helped me, but not necessarily. Every individual is different.
Okay. All right. So, what are some other things you can maybe tell us about Graves' disease? Is there any other things that we should know about it?
Well, Graves' disease is also known as a toxic diffuse disorder. It is commonly caused by hyperthyroidism. And what happens is the thyroid gland secretes too much thyroxine that your body can't use. And there's also hypothyroidism, which is just the opposite of hyperthyroidism. So there's two kinds of, problems with your thyroid.
So does one cause you to gain weight and one cause you to lose weight?
Yes.
So which is the one?
Hyper causes you to lose weight. Hypo has a tendency to, have you to gain weight.
Oh, okay.
Are there any exercise or eating habits that could prevent or treat Graves' disease? Are there certain things that you can do, like if you change your diet, will it make it better? Does your diet play a part in it at all?
Well, I think your diet plays some part in it, but you just have to be careful. Just eat a well-balanced diet. Just watch your iodine and your salt.
Right.
It all depends on what type of, if you have hyper, you really have to watch your iodine, like watch salt. But hypo, you need the iodine.
Oh.
So you have to just make sure when you use salt, it has the iodine in it. Like when you go and purchase the salt, just make sure you read the label, make sure it says iodine, salt.
Now, is it hereditary?
And exercise is good.
Say it again, I'm sorry.
I said, maintain a well-balanced diet, exercise, and take your medication.
Now, is Graves' disease hereditary?
It's an autoimmune disease. It's hard to say, because I don't know anybody in my family who has it. So I can't really say.
So with it being an autoimmune disease, it probably isn't hereditary, because most autoimmune diseases aren't, right?
Right.
Okay.
But I'm not really sure on that, because I said I don't know anybody in my family who had Graves' disease.
Okay.
I know on my dad's side we just all had large eyes anyway, so that's not necessarily they were diagnosed with Graves' disease.
Now, is
But
that...
my doctor...
Go ahead.
When my doctor first told me, I thought, well, I have big eyes anyway, but he said, I think you have Graves' disease. Right.
Is that one of the, dominant symptoms of Graves' disease? Because I know sometimes, there is an actress that I think has Graves' disease, because every now and then it seems like her eyes are bulging a little bit more.
Eyes bugging, eyes get real large.
Yeah.
And that's what happened to mine. My eyes got real. I have big eyes anyway, but they got real large and they started protruding.
Yes.
The eyelid kind of turns under, and my eyes was getting bigger. So what he had to do, I had to have surgery, just kind of put them back down in my socket to make them, not so budging. But they call it decompression of the, orbit of my eyeball.
Okay. So once they do get the bulge, there's no way that it'll go down. It's more or less you have to have surgery.
Most of the time you have to have surgery.
Okay.
But when your eyes really get like that, you have to have surgery.
Okay.
There's no way of getting around it, I don't think.
Right. Okay.
Because it's going to continue the tissue gets inflamed around your eyeball, and it just, keep budging out and keep budging out. And you'll probably see some pictures of, people with real big eyes, where the eyes almost like they're popping out of a socket. You really have to have the surgery.
Okay. Is there, I guess, is there a certain age that people are diagnosed? Is there an age bracket where it's more dominant that people find out that they have Graves' disease compared to between the ages of 45 and 60?
Well, you can start when in your 40s from reading from information.
Is there a test that can detect? Just say if I'm just I just want to know if I have it. It would actually have to be like acting up, quote unquote, in order for me to even.
Well, you can have a TSH a test drawn. That's just a blood test.
Mhm.
And then you should do a T3 and a T4, or you can just have a thyroid scan. It can show whether your thyroid is okay or whether it's large. But most of them just do blood work, a TSH, and it can tell, what's elevated or not. But if you just elevated, you should find, a possibility you might have Graves' disease.
Okay.
But you have other symptoms too. You have the palpitation, you have the weight loss, you have the diarrhea, you're irritable all the time.
And when you say irritable, what do you mean?
Just, that you can't get along with anybody. You just snap at it. Somebody says something to you, you just snap at them. You just,
okay, maybe some people I know that have.
I want to talk that way.
So you just snap for no reason, huh?
And you're always tired. Sometimes you're a lot of fatigue also.
Okay.
And sometimes you have a lot of weakness in your muscles.
Okay.
Well, thank you, Ma. I appreciate you doing this little interview for our healthy series for the month of December. I appreciate it. So I hope you enjoyed our little interview with my mother on Graves' disease, and we hope you got a lot of information. And if some of the symptoms that my mom described, if you do have them, by all means, please go get tested to find out if you do have it. And as we always say, don't forget to move something. Bye.